Today we are going to talk about carbonic anhydrase inhibitors, and drug in that category is the acetazolamide. So first of all we'll see the mechanism of action. Now as you can see, CO2 and H2O diffuses from tubular lumen into the tubular cell, and there is a formation of carbonic acid. H2CO3 is a carbonic acid with the help of enzyme carbonic anhydrase. Now this carbonic acid is dissociate into H plus and HCO3 minus. H plus is a hydrogen ion and HCO3 is a bicarbonate ion. It splits or dissociates. Now this bicarbonate ion transported into the interstitium. It will transport it into the interstitium or blood, and this hydrogen ion exchanges with the luminal sodium with the help of sodium hydrogen antiporter. Now what happens in the lumen? Hydrogen ion combines with filtered bicarbonate to form H2CO3. In the lumen, hydrogen ion combines with the filtered bicarbonate ion to form H2CO3. The H2CO3 is dissociated into CO2 and H2O with the help of carbonic anhydrase, which is present near the brush border cells. Now this is the theoretical part. Now we'll see the diagrammatic representation. Now you'll understand better. Now the mechanism of action of carbonic anhydrase inhibitors. Now what happens here? Actually, CO2 and H2O, this is the H2O and CO2, it will diffuses from tubular fluid to the tubular cell or tubular lumen to the tubular cell. When it diffuses, with the help of this carbonic anhydrase enzyme, it will get converted into the H2CO3, that is the carbonic acid. Right? Now this carbonic acid is dissociates or split into the H plus and HCO3 minus, that is the hydrogen ion and bicarbonate ion. Now the hydrogen ion exchange with the luminal sodium. Hydrogen ion exchanges with the luminal sodium. Here there is sodium exchange with hydrogen ion. There is an exchange of sodium. Then, and with the help of sodium hydrogen antiporter. Okay. Now that hydrogen ion combines with HCO3 or bicarbonate ion and forms H2CO3, and there is a formation of H2CO3. The H2CO3 dissociates into CO2 and H2O with the help of carbonic anhydrase which is present near the brush border cells of the renal tubule. Okay. So this is what is the normal physiology. This is what is occurring normally. Now where this acetazolamide or carbonic anhydrase inhibitors act? These carbonic anhydrase inhibitors, or the main site of action of acetazolamide, is a proximal tubule. The main site of action of acetazolamide is the proximal tubule or PT, or proximal convoluted tubule, PCT, and it also acts in the collecting duct. Okay. Now acetazolamide, by inhibiting the carbonic anhydrase enzyme, it will inhibit the carbonic anhydrase enzyme in the tubular cell, as well as it inhibit the carbonic anhydrase enzyme in the tubular fluid, in the lumen as well as in the tubular cell or renal tubules. It will inhibit the carbonic anhydrase enzyme. So if it inhibits that enzyme, so what will happen? It prevents the formation of H plus. Means hydrogen ion, and that's why sodium hydrogen exchange is prevented. sodium hydrogen ion exchange is prevented. There will be no exchange. Then because of that, sodium is excreted along with the bicarbonate ion. Because of that, sodium will get excreted along with bicarbonate ion in the urine. And in the distal convoluted tubule, there is an increased sodium potassium exchange that leads to the potassium loss, and net effect will be there is a loss of sodium, loss of potassium, loss of bicarbonate in the urine, and that results in the alkaline urine. So what is the mechanism of action of acetazolamide or carbonic anhydrase enzyme? Simply they inhibit, what they inhibit? This carbonic anhydrase. If they inhibit this carbonic anhydrase, which is present near the brush border cells of the renal tubule, so it will prevent the formation of H plus. And that's why there will be no exchange of sodium and hydrogen. With the help of that sodium hydrogen antiporter, so that sodium will get excreted along with the bicarbonate ion. And because of that, in the DCT, in the distal convoluted tubule, sodium potassium exchange leads to loss of more and more potassium, and the net effect is loss of sodium, loss of potassium, loss of bicarbonate ion in the urine, and that will result into the alkaline urine. So here, the main site of action of acetazolamide is the proximal tubule. It will also act in the collecting duct. So whatever we have said, it is written over here. Acetazolamide, which is a carbonic anhydrase inhibitor, by inhibiting the enzyme, it will prevent the formation of hydrogen ions. So sodium hydrogen exchange is prevented. There will be no sodium hydrogen exchange. So sodium will get excreted along with the HCO3. So in the distal convoluted tubule, increased sodium potassium exchange leads to the loss of potassium. The net effect is loss of sodium, potassium, bicarbonate, and that will result into the alkanization of urine. Now, where we use this acetazolamide is not used as a diuretic. Why? Because of low efficacy. Now, what are the therapeutic uses? It is used in the treatment of glaucoma. Carbonic anhydrase inhibitor decreases the intraocular pressure by reducing the formation of aqueous humor. So acetazolamide is used in the acute congestive glaucoma. Where it is used? It is used in the acute congestive glaucoma by oral or IV routes. Topical carbonic anhydrase inhibitors like dorzolamide, brinzolamide are used in the chronic simple glaucoma. Okay, acute congestive glaucoma and chronic simple glaucoma. So basically, it is used in the treatment of glaucoma because intraocular pressure is decreased, and means what happens actually, the ciliary body of the eye secrete bicarbonates into the aqueous humor. So carbonic anhydrase inhibition results in the decreased formation of aqueous humor and thereby reduces the intraocular pressure. Now it is also used for the alkanization of urine. And where we use this alkanization of urine? For the acidic drug poisoning like salicylate, barbiturates. If there is a poisoning of salicylate or barbiturates or any acidic drug, so we'll do the alkanization of the urine so that that drug will remain acidic in the urine and they will get not absorbed in the renal tubules, so they will get easily excreted from the urine. So alkanization of urine is done in case of acidic drug poisoning. Then it is also used in the acute mountain sickness for symptomatic relief and prophylaxis. It is better to administer it prophylactically. The beneficial effect may be due to decrease in the pH and formation of CSF. It is also used in the acute mountain sickness. Now, what are the adverse effects and contraindications? Adverse effects are it can cause hypersensitivity reaction like skin rash, fever, nephritis, or drowsiness, paresthesias, hypokalemia, metabolic acidosis, headache, and renal stones. These are the adverse effects of carbonic anhydrase inhibitors when it is given orally, like acetazolamide. Hypersensitivity reactions can be there in the form of skin rash, fever, nephritis, or there is a chance of drowsiness, paresthesias, hypokalemia, metabolic acidosis, then headache, renal stones can be there. Now, in which conditions it is contraindicated? It is contraindicated in the liver disease. Means hepatic coma can be precipitated in patients with cirrhosis due to decreased excretion of ammonia in the alkaline urine. There is a chance of hepatic coma, and it is also contraindicated in the COPD patients because there is a worsening of the metabolic acidosis. If there is a worsening of the metabolic acidosis, so there is a worsening of the COPD also. So because of this, they are contraindicated in the COPD and liver diseases. That's all.